Thanks, Ciarán. And I'd like to welcome this very, very important motion in relation to respite care services in Ireland. I think it's very, very good that we're talking about it today, and I think we have to see it in the light of post-pandemic and pre-pandemic. And respite care services are a vital care cog in that system. My previous life, before I came in here, I worked in respite services, so I understand the kind of the importance of respite care for family members and service users as well, and also the workers that work in care services and respite services. It's been, to say the least, extremely difficult in the last 3 years in relation to the ongoing kind of public health emergency. And respite care, Minister, has, to say the least, has been very, very arbitrary for them families that are trying to get access. It's been very, very, very difficult in some surrogate families that just don't get the hours in them situations. And I think during the pandemic, the withdrawal of day services and respite service had a profound effect. And it's almost incalculable what it actually done to service users, children, family members, staff, because them services literally were gone completely. And if you don't have a routine, if you don't have a relation to your peer group, if you don't have an educational space, if you don't have all that, it will have a terrible effect on the, family members and so forth. And I think the state is still recovering, and the services are still recovering in relation to that. And I'd like to kind of get your views on that, Minister. What has the state put in relation to that enormous void that went on in the last 2 years? Because it will always haunt me, some of the news reports coming from families where that service was simply gone, and it was just so distressing to hear family members saying, look, we have nothing. I'm in a situation now, I can see my child regress, and that service is gone. So that's, I'd like to kind of get your opinion on that. And I think, Minister, for carers, and there's a lot of carers in this country that go kind of unnoticed and do vital service, not only for their children, for their loved one and so forth, and that goes unnoticed sometimes. I think there should be a statutory entitlement for carers to have 20 days annual leave in relation to the work that they do. That should be a kind of a statutory kind of piece of legislation that's put into place where carers are given actually time off, and I think I think most people would agree with that. It makes sense. There's a huge kind of benefit in kind, not only to the state, because carers save the state a vast amount of money in relation to not, their loved one going into a hospital environment, and and that's very good. So, Minister, I'd like to kind of just get your opinions on relation to the effects of the pandemic, what it has had on day services and respite service. Where has the kind of intervention come in relation to filling that kind of, I suppose, that kind of void that had happened? We need more resources, but particularly where it happened in the last 2.5 years. Thank you.